Hello students. Now today we are going to study about the respiratory changes that occurs during exercises. What are the adaptations that the body uh, tries to maintain the equilibrium by changing some of the parameters in our respiratory system so as to meet the demand of high metabolism of exercise. So we know that oxygen consumption is increased during exercises and carbon dioxide production is there. So they will increase this 25 times. And what will be the effect? There will be increase in ventilation during exercise. There will be increase in perfusion, means blood supply to the different areas, not only for the lungs but in fact every organ, and especially the exercising muscles which needs more and more blood supply. So there is increased ventilation, the rate of depth of respiration will be increased and hence the ventilations, and there will be increased diffusion across the membrane of the respiratory tract. There will be increased diffusion across the membrane between the alveoli and the blood vessels, across the membrane between the blood vessels, interstitial tissue and the organ. So across every steps where diffusion of oxygen occurs, the rate of this diffusion will be increased. Now, as we have seen in cardiovascular system, the respiratory system also, there is a short-term and long-term adaptation or effects of the exercises, and you can see the short-term responses are there will be increased in respiratory rate. The number of breaths that is taken in 1 minute will be increased. Now at rest we can breathe at least 12 to 15 times per minute, but when we do exercises, this 12 to 15 times of breath can increase up to 40 to 45 times per minute. Now when we begin to exercises, oxygen is consumed and carbon dioxide level increases. So we can say this carbon dioxide is a waste product of the energy production. Now this carbon dioxide is very important because it is a trigger for the respiratory centers. That means whenever your oxygen supply or oxygen is used and carbon dioxide produced, then this carbon dioxide is only the stimulator, and this stimulates the respiratory centers in the brain so that we can increase our respiratory rate. So the energy demands increases whenever the individual exercises, and for that demand to fill up, more and more oxygen intake is required, and thus there will be increased breathing so that more and more oxygen is diffused and utilized by the body. The respiratory parameters will also increase. Like in normal breathing, the tidal volume is only 500 ml, but when we do exercises, it increases up to 1000 ml. But in athletes who are trained person, in them it can goes beyond 1000 up to 2000 ml. So the normal tidal volume in the athletes are also more than 500 ml. So, but in athletes the tidal volume can go at maximum as 2000 ml, that is beyond the normal individual exercise capacity. Okay. Now there will be change in concentration when we do exercises. There will be change in concentration of H plus and CO2. They will go towards more acidic environment, and this acidic environment triggers or is detected by the receptors in the blood vessels, and now the signals goes to the brain. They will change the breathing depth to suit the demand of the body. So in the case of exercises, the increased concentration of H plus and CO2 will ultimately cause increase in depth of breathing and increase in tidal volume. So we can see in exercises that's why the tidal volume increases. The third short-term effect of respiratory system in the exercise is increase in ventilation. So the rate of ventilation, that is the breathing per minute, will increase. Depth of respiration, or we can say tidal volume, that also increases, and they will ultimately increase the ventilation per se. Okay. Now what is the minute ventilation? It is the tidal volume into the rate of respiration is known as minute ventilation. Since both are increasing, so minute ventilation will also increase. Now why there is an increase in tidal volume? Why there is an increase in tidal volume? So what happens, as we know, when we do our exercises, there are proprioceptors that are present in the joints or tendons. When we are running, suppose, or doing some exercise or movement, these proprioceptors senses the positions, location of the body, joints in a space, and they will send a reflex response to the brain, and that brain will they will send the information, motor information, to increase the ventilation. The second factor that increases the tidal volume is during exercise is the sympathetic stimulation that causes vasoconstriction, that feeds the carotid body. So in a carotid body you get less supply of oxygen, so carotid body suffers from hypoxia, and then there will be masses taken to the brain via glossopharyngeal and vagus nerve, and there will be increase in respiratory drive. The third cause of increasing tidal volume is the oscillation of the blood partial pressure of oxygen and partial pressure of carbon dioxide. That will, the change, the change in the partial pressures of oxygen or carbon dioxide, they will stimulate the carotid body, and hence the carotid body will send the message to the brain, and then there will be increase in tidal volume. Severe exercise will cause lactic acid accumulation, as we know, because the anaerobic process of glycolysis will be set in, okay, and the blood pH, due to acidosis, that falls, and the decrease in blood pH makes the environment acidic, and hence the acidic environment always increases the respiratory drive. Now during exercises there will be rise in body temperature, and that can directly affect the respiratory center in the brain. So all these causes increases in tidal volume. Now we can see the exercise intensity versus the minute ventilation, that is the tidal volume, the respiratory rate. So you can see at the rest for the 6 liter per minute, when your exercise intensity becomes increased, the minute ventilation also increases. Okay, so we can clearly see here the ventilation increases almost linearly with the increase in the intensity of the exercise. In rest, we can ventilate 6 liter per minute, slow walking 20 liter per minute, fast walking 40 liter per minute, jogging 50 liter per minute, and the fast running it is 80 liter per minute. So you can see the difference. At rest we have minute ventilation is 6 and fast running it is 80. So how does this pulmonary ventilation, or in simple words breathing, increases during exercise? What happens? What happens during exercises? So during light exercise like walking, how does it increases? It increases by increasing the tidal volume. And when we do steady state exercises like jogging, it's not a dynamic, it's static exercises like jogging at one place, they will be increasing both the tidal volume also and the frequency of breathing. That means the depth also increases, the rate of respiration also increases. In intense exercise like running, sprinting, there will be more focus in increasing the frequency of the breathing. Okay, rate of respiration will be the main focus during sprinting, but during light exercises the more focus will be on increasing the tidal volume, that is the depth of the respiration. So in very light exercise like walking, the depth is more, while in intense exercises like sprinting, the depth is less. Okay, it's a shallow breathing, but yes, frequency is very much increased. But in the light exercise, there will be not, the frequency will not increase. Okay, in fact it will take much more time than a normal between two breaths, right? What is the mechanism of increased ventilation? When there is an abrupt increase in ventilation, then there is a brief pause and there is a gradual increase. So there are explanations for both of these. The increase, abrupt means what? Acute increase. So whenever there is a acute increases of ventilation, this is guided by the neural mechanism, while the graded increase in the ventilation, this is guided by the chemical mechanisms. Now when we talk about the acute or abrupt increase in ventilation, and its guiding principle is the neural mechanisms. So what happens in neural mechanism? There is a psychic stimuli. Even before you do the exercises, that the mere thinking of doing exercises, that is known as psychic stimuli, it comes from limbic system. They will increase the abrupt ventilation. While you do the proper exercises, the proprioceptors from the joints will also cause abrupt increase in ventilation, So these are the neural mechanisms which guides the abrupt increase in ventilation. Now, when we do the abrupt, when we have increased our ventilation, so what happens? A brief pause will come. Okay, there will be increase in carbon dioxide, and that increase in carbon dioxide will stimulate the brain, and there will be gradual increase in ventilation again, but that will be guided by the chemical mechanisms. And this chemical mechanism is nothing but the partial pressure changes in the form of PO2 and PCO2. So let's talk about the arterial PO2. What happens to that? It is maintained due to proportionate increase in ventilation. During strenuous exercises, lactic acidosis maintains the arterial partial pressure of oxygen. Okay, increase in ventilation, it actually causes the increase in oxygen consumption. So that means we now know that oxygen is maintained. Arterial PO2 has to be maintained, and for proper maintenance of partial pressure of oxygen during exercise, this lactic acidosis and this increase in ventilation, which directly proportionate the increase in oxygen consumption. So in that we can say they are proportionate increase in the partial pressure of oxygen. Is the picture same for the arterial PCO2? Let's see. One second. So you can see the arterial pH, how it changes. During exercise there will be excess anaerobic metabolism by glycolysis. There will be increased lactic acidosis, and CO2 will be formed more and more, and this CO2 will stimulate the respiratory center in the brain to increase the ventilation, and this will cause further increase in ventilation beyond the lactic acid threshold. This is known as isocapnic buffering. So buffering means what? Buffering is something like which avoids or prevent any changes. This is known as buffering. So whenever there is an increase in carbon dioxide, there will be increase in ventilation, and this increase in ventilation will try to wean off the carbon dioxide that has been accumulated. So this is known as buffering things. The changes in the form of increased carbon dioxide is prevented by increased ventilation. Okay. So the same thing, increase in degree of the sizes, how PCO2 and PaO2. You can see the difference is that the partial pressure of oxygen during the size is maintained, but in case of partial pressure of carbon dioxide, it will be maintained for a certain period, and there will be decline. There will be decline in pH, and also the partial pressure of CO2. And the pH, you can see it also moves in the direction of acidic environment because of increase in production of carbon dioxide and H+. So you can see only the partial pressure of oxygen is somehow maintained, but this partial pressure of carbon dioxide is increased, and hence the pH will be in the acidic environment, right? In exercise, there will be also increase in oxygen uptake. Hyperventilation means increase in ventilation that happens during exercises will also increase the oxygen uptake in the lungs. So when your respiratory rate depth will increase, you will also try to gather up more and more oxygen from the environment to the lungs, and that also have some role in maintaining the oxygen saturation. Maximum oxygen uptake is 20 times the resting volume of oxygen uptake. So if there is a moderate type of activity, so the oxygen uptake is 35 to 40 ml of oxygen per minute per kg body weight, while if there is a strong athlete, so he can take more and more oxygen. He can take up to 80 to 90 ml of oxygen per minute per kg body weight. So you can see how a moderate active person and a strongly athlete person can increase their uptake of the oxygen from the environment. Whenever there is a pulmonary ventilation that increases, there will be increase in perfusion, that is supply of the blood and oxygen. So there will be change in ventilation perfusion ratio, and that determines the dynamic of circulation. Okay, because of increase in ventilation, the oxygen supply has moved to a portion which was previously dormant or not opened up, not perfused. So the perfused area to the unperfused area, that is due to the increased pulmonary ventilation, and this dynamicity is known as dynamicity of the circulation. This will lead to the extraction of oxygen from the body by exercising muscles. So more and more perfusion is there, so that means more and more diffusion of oxygen from the respiratory membrane, and hence more blood will be saturated, and the oxygen can be taken up to the most demanding muscle, that is the exercising muscle, right? So what are the mechanisms of increased oxygen uptake? First of all, increased alveolar to arterial gradient of PO2. Okay, so there will be increased gradient. I mean, the partial pressure of oxygen in the arterial compartment has to be less. The partial pressure of oxygen in the arterial blood vessels has to be lesser than the partial pressure of oxygen in the alveoli, and the partial pressure of oxygen in the alveoli has to be lesser than in the environment, so that there is a flow of oxygen from the environment to the alveoli to the blood vessels. There has to be increased perfusion of the lungs, as I said. More and more the dormant part which was unperfused now becomes perfused. There will be opening of the more and more alveoli, and hence more diffusion or uptake of oxygen. The third reason, increased diffusion of oxygen across the respiratory membrane, the same thing. Now, this uptake of volume of oxygen is the index of functional capacity of the individual to sustain exercises. So, up to what duration the individual can sustain exercises depends upon this increased oxygen uptake. So this becomes VO2 or increased oxygen uptake is the index of the functional capacity of the individual to sustain the exercises. During strenuous exercises, it is the oxygen uptake of the muscles that does not keep up with the oxygen demand of the muscle. Okay, that cause pulmonary ventilation is usually adequate, usually more than adequate. So it's very much important that during strenuous exercises there is a disbalance, but that is being aided by the pulmonary ventilation, which is much more adequate. So the oxygen supply from the blood to the muscles is less than the pulmonary ventilation that takes place in the lungs. So we will see a different Bohr effect and many other effects that occurs at the lungs level, pulmonary level, and the tissues level. Amount of blood flow to the muscles increases. That will cause increased release of oxygen from the blood. So more and more blood flow to the oxygen occurs because of to meet the increased demand of that exercising muscles. So oxygen will be more released to the tissue to the muscles. Okay, and we know at rest 100 ml of arterial blood having 19.4 ml of oxygen is equal to 5 ml of oxygen to the tissues. Okay, so in the oxygen volume 5 ml that is taken up by the muscles. But if you do exercises, 3 times more oxygen will be taken up by the same 100 ml of the blood. That means what? During exercises, what changes has taken place? The same amount of blood carries more and more oxygen. That means the oxygen uptake has been increased. Right? Oxygen utilization increases to about 80%. So of course never it is 100%. Oxygen utilization is never 100%. So oxygen hemoglobin dissociation curve you can see. I think we know the oxygen sigmoid nature of this graph. Okay, and there are factors which we have studied. How in CVS you must have studied oxygen hemoglobin dissociation curve. What are the factors that causes this curve to shift to right and curve to shift to left? Now factors that causes shifting this curve towards right is decreased pH, that is more acidic environment, increased temperature, increased partial pressure of oxygen, increased 2,3 dpg. So increased partial pressure of carbon dioxide, increased 2,3 bpg, increased temperature, decrease. So they are more, this is the acidic condition in which there will be more, unloading of the oxygen, and the tissue will get or pick the oxygen from the blood. So this transport of oxygen at the tissue level, we can study this by the effect known as Bohr effect. So whatever the factor that is shifting the curve towards right is actually there is an unloading of the oxygen to the tissues or the muscles. This is the Bode effect. Now two terms comes in the exercising physiology: oxygen deficit and oxygen debt. Okay. In the beginning of the exercises, oxygen consumption is less than oxygen demand. So what will happen? When at the time of just starting exercise, or you just have done in a very first phase of exercises, there will be more and more acute demand, and your oxygen consumption is not up to the mark. So when there is a deficiency of oxygen, how is oxygen going to be taken? It is to be met by the anaerobic pathway. An anaerobic pathway will give rise to some currency in the form of lactic acid, NADH, NADPH. Now, this depth or this currency will be utilized after the exercises, when these currencies in the form of lactic acid and NADPH will cause the deficit of oxygen to be fulfilled. What happens after exercises? Amount of excess oxygen is consumed during the recovery phase. So more and more oxygen is consumed, more than that is required. Why? Because that oxygen, the excess oxygen taken, will convert this lactic acid and NADPH into its original source. So for the time being, we can somehow correct this oxygen deficit by anaerobic pathway. But this anaerobic pathway has to be corrected by giving depth. उधार दी, ये उधार है, इस उधार को चुकाना है. कैसे चुकाओगे? ज़्यादा से ज़्यादा ऑक्सीजन लेके. कब? इसलिए हम जब एक्सरसाइज करते हैं, बैठ जाते हैं, when we are tired, we hyperventilate, we take more and more oxygen just more than that is required, and that oxygen is utilized. Okay, so lactic acid removal requires oxygen. So lactic acid that is being formed, NADPH that is being formed, that requires oxygen for its removal to its original source. So that is oxygen deficit. How it is corrected? And this depth is paid by the hyperventilation after the exercise. Oxygen deficit and oxygen depth. Increased lung diffusion. This is another changes. During strenuous exercises, there is 3 times increase in oxygen diffusion from the alveoli to the blood vessel because of massive increase in blood flow to the lung. Okay, and dilatation of the capillaries surrounding the alveoli. So both of these, increased dilatation of the capillaries and the increased blood flow to the lungs, they all increases the oxygen diffusion. Now we have seen this short-term effect. Let's see long-term effect. Lung capacity will increase. Okay. Lung capacity is equal to vital capacity plus the residual volume. A greater quantity of air is needed to move in and out during during exercises. Lung expansion occurs. So anatomically, the long-term effect occurs anatomically. We can see the short-term is physiological, but long-term effect is the anatomical. So anatomical changes is what? Lung expansion occurs to meet the demand. More the expansion, there will be more provision of the efficient inhalation and expiration. Increased vital capacity. Vital capacity is the maximum volume of air that can be expired after maximal inspiration in one breath. This is known as vital capacity, mainly due to the increased strength of intercostal muscle. So it's also a type of anatomical change. Because of increased strength of intercostal muscle, there will be increased vital capacity. So it's a long-term effect. Increased strength of respiratory muscle is also known as a long-term effect. Diaphragm and intercostal muscle increases in strength, results in an improved ability to breathe in more air for longer with a less fatigue. Aerobic training tends to improve the endurance, or you can say strength, of the respiratory muscles. So when we do the aerobic training, that will increase the strength of the respiratory muscles, so that you can have an ability, improved ability to breathe in more air for a longer time with a less fatigue. Anaerobic training, so that was aerobic training. This anaerobic training tends to increase the size and strength of the respiratory muscles. So respiratory muscles का size and strength will increase by the anaerobic training, and respiratory muscle का जो capacity होता है, that will increase by the aerobic training. Increase oxygen diffusion rate. Increase in number of and the size of capillary will lead to obviously more efficient diffusion. Okay, you can see how oxygen diffusion are taking place. Regular training leads to better transportation of either oxygen or the carbon dioxide. Okay, so it means not only the oxygen diffusion is increased, the carbon dioxide diffusion is also increases during the exercise, and this is the long-term effect of the exercise. Now, this is also long-term effect of exercise on respiratory system. It's the increased anaerobic or the lactate threshold. That means you don't fatigue early. Okay, even if the lactic acid is formed, but that lactic acid will cause you fatigue much more later. So that is the advantage that an athlete gets. So it's a long-term changes. So due to improved oxygen delivery and utilization, a higher lactate threshold is developed. So in athletes we can know, or the long effect, there is an improved oxygen delivery and utilization. So thus lactate threshold is set up to a higher level. But who are not athletes, okay, that in them the fatigue will be much more earlier. Much higher exercise intensity can therefore be increased, and this lactate and H plus ion accumulation is delayed. That means the threshold is increased. The athlete now can work for harder for longer, right? So without any fatigue, he can work for longer. During exercise, the heart becomes more efficient, the stroke volume is increased, and as a result, resting heart becomes lower. As in athletes, recovery after exercise becomes quicker, blood volume and red cell also increases. These are the effects of the exercise. Arteries grow larger, diaphragm grows very stronger. If you see, the lungs capacity will increase, heart workload is decreased, less chance of heart disease, increases in capillary networks with the more dominant capillary networks opens up, blood supply to the heart increases. So more dormant capillaries open up, there will be more supply of the to the heart. Okay, less chance of heart disease. So no question of ischemia and all. So these are the cardiorespiratory training effect. Now benefits of exercise, you all know: weight loss, increase respiratory efficiency. Okay, uh, in this corona, it keeps you healthy and keeping viral illness at bay. Reduces all health ailment, improves health of the heart, increase lifespan, slows aging process. It boosts up mood, of course, strengthens muscle, bone, tendon, ligament, improves our metabolism. It reduces anxiety and stress, improves cognitive skill, improves body efficiency. So you can say that fitness is not a seasonal hobby. You have to put this fitness regime into your lifestyle as you do your daily uh, things. This fitness regime has to be also done daily into your lifestyle. So I think this is it from the exercise physiology. There is much more actually, but I think we'll have to uh, go more faster, because in book there are more details given and we have covered it in a very shorter way. So I think you should read the exercise physiology, and if there is any difficulty you can post me questions. Okay, thank you so much.